Hi everyone, Dr. Lisa Medaglia here, also known as Dr. Lullaby. Today we're going to talk about coexisting conditions with a focus on mood and pain. So when we're talking about mood, the most common mood symptoms that go hand in hand with sleep problems are depressive symptoms and anxiety. So when we look at the diagnostic approach for depression and anxiety, we see that sleep problems come up as one of the types of symptoms that are common for these types of problems. And so we also know that when people are struggling with mood symptoms, it's really hard to sleep, right? So if you're feeling down and depressed or you're feeling anxious and worried, then it's hard to kind of calm your thoughts enough and calm your mood down enough to be able to fall asleep and return to sleep. So because of that, the first question I ask for patients with coexisting conditions is whether they are working with a care team in the psychiatry space. We want to make sure that they're working with a therapist and or a psychiatrist if needed, and that those treatment strategies are working for them and that they're consistent with their approach. So when mood symptoms are managed or at least as well managed as can be, then we have a better chance at seeing gains in the sleep space. So we have a better chance at seeing that when you implement the behavioral strategies we're talking about, they'll work for you. So that's really important. It's also important to think about and remember that when there is sleep loss, it's harder to control mood and emotions. So that means that sleep loss in patients who have underlying mood symptoms or mood disorders are going to see kind of exacerbations in their symptoms, worsening of their symptoms if they're not getting enough sleep. So it just kind of highlights the importance of our patients with this space of coexisting conditions to work on sleep and take their sleep plans very seriously. And there are ways to make sleep gains, and you can make sleep gains. And the best shot at that is making sure that mood is well managed. So the next area to talk about is sleep and pain. So I see a lot of patients in my clinic that suffer from chronic pain, suffering from anything from migraines to arthritic pain to recovering from back surgeries. So their pain is something that is a different concern for sleep. So when patients are in pain, they are more likely or more vulnerable to have insomnia. It's really hard to fall asleep and return to sleep when your body is signaling to the brain that something's wrong. Also, we see sleep fragmentation and more frequent sleep cycle shifts. So there's generally kind of more sleep fragmentation in our patients who are struggling with pain. So the issue is that when there's sleep loss or poor sleep quality, it's harder to get through the day when you're struggling with pain because you have a higher sensitivity to pain and a worsened experience of your pain when you're sleep deprived or have poor sleep quality. So because of that, it just kind of highlights the importance of working on a sleep plan and doing whatever you can to have optimal sleep wellness so that you have your best chance of getting more sleep. And then in addition, kind of back to this earlier point, it's important to be working with your care team and making sure that you're following up closely with pain specialists or your primary care doctor to make sure that you're doing whatever you can to manage your pain optimally. So in general, working on sleep while struggling with coexisting conditions is possible. Just remember to work closely with your care team while going through our lessons. Thank you.